I really loved skiing, but it's really hard life to be a skier. We spent many days on the snow. It's always this part, the physical training was really hard for me. I broke my ACL on training in Argentina. I was skiing and my knee twisted and the ligaments were broken.
The story with Veronika is a very long story. She first came 4 years before the Olympic Games in Sochi, where she sustained left ACL ruptures. And at this time there were no other option than to treat her conservatively, so she missed the Olympic Games. Just 5 months before the Olympics in Korea, she sustained right ACL ruptures.
The first time I was not sure, but the second time I was really sure. When it broke, I started to cry that everything is done.
She was devastated because huge probability to miss the Olympic Games. Again, because she was concerned that the conservative treatment failed 4 years before, she went to visit me and to ask me what was the other option that we can try for her to participate to the Olympic Games.
So he proposed me this solution that I can be back faster, that it will take just 3 months for the recovery to come back. I was really confident on him and I said I have nothing to lose, I can just win.
I explained her what the solution to repair the ACL, but the testing before the surgery, she had an explosive pivot shift. In her case, the ACL was torn cleanly off the bone, and after suturing the ACL, we are able to put it up and reattach in the proper anatomic location. Then we run a biocompatible suture called fiber tape from the femur down to the tibia along the ACL. The fiber tape is attached with a tightrope implant on the femur and a swivel lock on the tibia. This internal brace helps lower the risk of rupturing the ACL during rehabilitation and healing. Greg Di Felice, the American surgeon, published a series of patients with 5 years follow-up with only 1 case of ruptures. So I was completely confident because I trust him and his clinical result was good. It's logic to address the ACL tears, but also to address the anterolateral injury. So I also add an ILL reconstruction, which is, I think, a very good combination because you protect the repair as well.
After the surgery, every day I did progress on the ski. I was able to participate on the Olympic Games. I did 2 World Cup races. Everything was going just perfect.
For Veronika, the recovery was very, very impressive. 1 week recovery for her is 1 month for normal ACL reconstruction. In fact, she ran after 4 weeks. So she was completely confident of the procedure because it was safe, and she really appreciated the fact that we don't take any risk for the future of her life.
I just can say thank you to Bertrand that I think we did a nice job together. I am really happy that we did that and that it works and that maybe it will help for the other in the future.